Emily just joined our group this year, and she's been really instrumental to help kind of guide and kind of coordinate our Center of Excellences here, including our HDSA Center of Excellence. She is our research coordinator, runs our Enroll HD program, which is our longitudinal study, and she'll talk to you a little bit about research. So she has a lot of experience so far, has worked on a few other trials as well. Um, and she's prepared something for that. But again, I also want to give her thanks for helping organize this event today. All right, take it away.
You guys should be looking at my presentation now. Is that correct, everybody?
Yep.
Perfect. All right, like I said, my name is Emily Reynolds. I'm a clinical research coordinator here at the Norman Fixel Institute. And I'm going to be talking about demystifying clinical research trials. Thank you to Dr. McFarland for first presenting on some of the more nuanced details of clinical trials and some specifics, but my presentation is going to be more generalized as an explanation of research as a whole. So I'll start with what is research? There are lots of different types of research, but in general, research is how the scientific community gains more knowledge or tests new treatments through the collection of data. These new treatments can include a variety of different unapproved or experimental medications, different combinations of previously approved medications, and also things like implantable devices. Now, not all research conducted is done on humans. Some of it's done on mice, like our nice little mice models for HD, and then some is done with humans, but not necessarily with a new drug or a new investigational product, just to learn more about certain diseases. So now that we've learned what is research, we can talk about how to find a research trial. Getting started in research can be scary. Sometimes you don't know where to start, but your clinical staff are going to be the biggest helps to finding local trials to you to participate in. Now, if you don't have the honor of having a big academic institution like UF near to you, you can definitely use a variety of sites, specifically clinicaltrials.gov, where all research trials have to be registered. You can search through their criteria to find something that may interest you and you may be appropriate for. They have lots of different little search features so that you can find those studies. Thanks Alana to also shouting out HD Buzz. They are a Huntington-specific research site that produces research-based news, and they're a great resource to find new trials that are going on and updates on current trials. You know, we're in an internet age now, so you can also just do some quick Googling. I encourage anyone to see what's around for them, okay? Once you find a trial that you're interested in, the first step in the process is gaining informed consent into that trial. So research is always voluntary, and to make sure participants know what they're signing up for, an informed consent form must be signed before any study activities are performed. Now, during that informed consent process, a study staff member will go over all the important details of a study, like the name of the study, who's conducting the study, what are the reasons for performing the study, what will you be doing during the studies, the assessments, and how often you'll be visiting, along with the risks of participation. You will also have the time to ask any questions that you may have, and those will be answered before you have to sign the consent form. The study staff will also sign the consent form, just verifying that the document was fully explained and that the person signing understood and had all their questions answered. Now, consent is definitely a dialogue, and you don't have to consent to a study even if you're interested in. A good study staff member will make sure that you fully know what you're getting into before you start any part of the process, okay? Oops, sorry about that, lost my spot. Here we go. So what's required for you for research? For any research trial, participants are required to meet a set of eligibility criteria, which is a list of criteria which can include a diagnosis of a certain disease, the age of a participant, some of their lab values, clinical rating scores, depending on what they are and what the study is, to be able to be deemed fully eligible to start in a trial. Specifically for experimental medication or device trials, before receiving any device, they want to make sure it's safe for you. So they have a screening visit to verify that you meet all of their eligibility criteria before starting you on any treatment or implanting a new device. So again, for good trials, you have to have good data and good data collection to be able to confirm the results of a trial. It's important for any participant that signs up to try their very, very best to stick to the predetermined treatment plans, visit schedules, and perform all of the assessments required by the trial as long as they feel that it is safe to do so and the investigator in the trial agrees with that. That being said, everyone in research knows that life happens and circumstances can change, but trial participation should not be taken lightly. And if there's concerns about any aspect of a trial, those concerns should really be addressed before consenting into the trial. Participants do have the option of withdrawing from a study, and they're not required to give a reason if they did want to withdraw from the study. For safety reasons, sometimes the staff can request that that participant do come back for one last visit, make sure that they complete some assessments to make sure that if they're getting off a drug, everything is safe and that the patient leaves well. Okay. So why participate in research? There are a variety of different reasons people might participate in research. Some of those include chances to receive an experimental drug or treatment, helping researchers in general just learn more about their disease and the process and how it progresses, or also the hope of impacting future generations with new discoveries. Everyone's reason will be personal to them and different, so no matter what they are, they should be respected by everyone. All right, so with the rest of my time, I'm going to go over some of the language that you'll see in study titles and consent forms and explain some of the wording. Now, up at the top here, I have the starting of a lot of different research titles, and that phrase is a phase number, which could be 1, 2, 3, or 4, randomized, double-blind, placebo-controlled trial. So I'm going to break down every aspect of that, and that starts with the phasing of trials. So there are 4 different phase types that could be included in a study, starting with phase 1. Now, phase 1 trials are mostly for safety, can also find appropriate dosage of experimental drugs, and this type of study is performed on a very limited number of participants. Once they pass phase 1, they go on to usually phase 2 if they surpass their goals. That includes more participants. It's able to determine if the drug is starting to be effective for treatment of the condition. What dose is most effective can also be found. And then they might start to see if there's side effects for experimental treatments in these kinds of trials. In phase 3 trials, there's an even greater number of participants that are used to track efficacy over the greater population of the trial, as well as continuing to determine and refine the dosage of experimental drugs. And then usually after a phase 3 trial in the United States, a drug can be approved by the FDA. Now, phase 4 trials are conducted on FDA-approved medications, and they're really used to track long-term side effects in the more diverse, greater population of participants. Right, we're going to move on to what some of these other words in those titles mean. I mix these up a little bit just so they feed better into each other. The first term that we're going to talk about is placebo control. Now, what that means is a participant, when they're in one of these trials, could be taking experimental drug, or they have a chance of receiving what's called a placebo. Now, a placebo is an inert copy of the experimental drug that should have no clinical effect. So these drugs typically look exactly alike, so they cannot be distinguished from each other. And that helps with blinding. We'll talk about blinding now. Double blind, in that title, means that neither the participant nor the investigator giving the drug knows whether the participant is receiving the experimental drug or the placebo. So any gain or loss of function, they can't tell whether it's that drug or the placebo that are causing those gains or losses until the end trial results come out. Now, there are definitely certain mechanisms where an investigator, if safety is a problem, can find out what the patient is on. So don't ever think once you're in one of these trials, you'll never know, or if there's a problem, we won't be able to know what you're taking. Now, this last term is randomized, and that means the participant is placed into either the placebo or the experimental treatment group at random based on certain factors. Trials nowadays are very complex, so it's not exactly like flipping a coin, but we use that a lot as an analogy for it. Just at randomly, based on certain factors, you'll be placed in any of the treatment groups. Sometimes there's more than 2 treatment groups if they're trying to also find the dosages that are correct. But being randomized just means that you have an even chance to be placed in any of the treatment groups that are in the trial. And whenever you're in these trials, the consent form will fully explain what the different treatment groups are and your odds of being placed in any of them. Right? Now that you fully understand that starting of most trial titles, we're going to go over just a few other basic terms that are used in a lot of consent forms. So our Institutional Review Board, or IRB, is a group of diverse individuals that are tasked with ensuring that research at any institution is conducted ethically, and they do that by reviewing aspects of the study and making sure that all the risks are as little as possible and acceptable based on what you might gain from the trial. Now, an investigator is the person who's responsible for overseeing a study, and in most clinical trials, that's going to be a medical doctor. Here for Enroll, which I'm the study coordinator for, our Dr. McFarland is the investigator. Now, the sponsor, who you'll see on the consent form, that's going to be the party that's paying for the study. And that can be, a drug company if it's a drug trial. It could be a governmental institution like the NIH or even the DoD. And then it could also be a university that's running the trial, such as UF. Now that we've gone over those, I hope you're not bored to death on all the different parts of research, but I want to give a big, big thank you to everyone out there listening and anyone even just interested in clinical trials. They're really the backbone of everything we do in the medical field, and your participation is very vital to that. It's always voluntary, like I said, so don't feel like you have to, but if you want to, please, reach out to your clinical staff, see what you can get involved in. All right. Thank you guys so much. That's all for me.